Hello, everyone, and welcome to the Agent Orange Latin America Center's first public event at the Atlantic Council. You can watch our broadcast we've done earlier today at the IMF studios of the Atlantic Council there. But this is shaping up to be a very busy week on all things Latin America and the Caribbean as part of the Atlantic Council's broader IMF World Bank Week programming, where we're hosting dozens of ministers from the region, about a dozen different ministers and executives. So great to see you all today here, including Secretary Guberman, who's here with me on stage. I'm Jason Marzak, Vice President and Senior Director here at the Atlantic Council, our Agent Orange Latin America Center. Today's event is part of our health economics work at the center, which is organized and with the support from FIFARMA, the Latin American Federation of the Pharmaceutical Industry. So I want to invite to kick off today's conversation to the podium, Connie Losada. Connie is the president of the board of directors of FIFARMA. Connie, please welcome.
Good afternoon, everyone. Welcome, and thank you for joining us today. We are enjoying a great weather today in Washington, D.C. It's a true pleasure to open this event organized by FIFARMA in partnership with the Atlantic Council Center. My name, as I was introduced, is Connie Losada, and I have the honor of serving as president of the board of directors of FIFARMA. So on behalf of FIFARMA, I would like to extend a warm welcome to all of our distinguished guests and speakers, especially our colleagues from PAHO, the World Bank, and the ministers and senior representatives from across the region who have joined us today. Your presence here reflects something very important, a growing recognition that health is not only a social priority, but also a strategic economic issue. So across Latin America and the Caribbean, our countries are facing a common challenge: how to ensure that sustainability, financial sustainability of health systems, while also responding to growing health needs, demographic change, and increasing pressure on public budgets. Too often, health continues to be seen only as a cost. But the evidence increasingly shows that this view is incomplete. When people do not have access to prevention, to timely diagnosis and effective treatment, the impacts go far beyond the health sector. It affects productivity, labor participation, household income, public finances, and long-term economic growth. The data is clear. According to recent studies in the socioeconomic burden of disease, in 2022, cardiovascular diseases, cancer, and diabetes accounting for average losses equivalent to 3.4% of GDP. Just to give you a sense of the size of this impact, in countries like Costa Rica, this represents 2.8 billion of impact, and in countries as large as Brazil, as much as $136 billion. These are not only health statistics. These are economic signals. They remind us that inaction has a cost, and that investing in health generates value for far beyond the clinic or hospitals. This is why today's conversation is so timely and so important. We are here because we believe it's time to elevate the discussion. Health must be part of the economic and development agenda of our countries. It must be understood as an investment to strengthen societies, support productivity, build resilience, and enable sustainable growth. And this requires collaboration. It requires government, us, private sector, multilaterals, academia, and civil society to work together with a shared sense of purpose. It requires better evidence, better dialogue, better alignment with health priorities and economic decision-making. At FIFARMA, we firmly believe that innovation is part of this discussion. Innovation in prevention, diagnosis, treatment, also financing and policy design can help countries improve their outcomes, use resources more effectively, and create stronger and more sustainable healthcare systems. Today is an opportunity to exchange perspective and to explore how we can collectively move from aspiration to action. We hope these discussions helps identify practical pathways to place health where it belongs, at the center of national development strategies. Thank you again to the Council, the Atlantic Council, for partnering with us in convening this important dialogue, and thank you to all of you for being part of it. I look forward to the conversation ahead. Thank you.
Well, thank you so much, Connie, and thank you so much, Secretary Guberman, for being here with us today. I know you have quite a busy week here in Washington, so appreciate you taking some time from your day to be here as part of this important conversation.
Thank you. It's my pleasure to be here. The Atlantic Council is a very good partner of Argentina these days, so we are happy to be here.
We're happy to have you here. Even better if we're having this conversation in Buenos Aires, but the IMF World Banks are in Washington and not in Buenos Aires, so we're having this conversation here. I'd also like to just take a moment at the beginning and thank again our partners for this conversation. FIFARMA, of course, but also Roche, Johnson & Johnson, Bristol Myers Squibb. This event, it really goes to part of what Connie was saying in her beginning, is the Atlantic Council and the Latin America Center. We decided a few years ago on the heels of COVID that we needed to continue the conversations about health and that we couldn't just let that conversation fall the wayside because we're moving from the pandemic. Because we do so much work here on commerce and investment, we really see, as Connie was saying as well, health is being strategic to the broader economic agenda for countries writ large. So we were in Argentina last week, our conference, Argentina's Turning Point, Accelerating Economic Takeoff. And I'll say one of the leading topics was how Argentina's tightly managed fiscal accounts are one of the defining anchors of the current economic program. So real congratulations again to you, Secretary, and to Mr. Caputo and President Milei and the whole government on that. This is highly relevant in our current age. There's high debt levels, economic uncertainty, surging energy prices, and these are all challenging public finances that we're seeing around the world. So I can't think of a better way to start our conversation than to get right into it with you Secretary. I want to begin on the international context. So as those who follow Argentina know, Argentina has rapidly fixed its fiscal challenges and I'll say a quick reordering of its historically challenging public finances, and this has been done under the Milei administration. In a complex global macroeconomic environment, what are some of the lessons that Argentina can share on prioritizing efficient health investments, but also doing so given the many, many competing fiscal pressures?
Okay. Well, of course, it's not an easy task to make a fiscal adjustment the size that we already made, and we're still working in that sense. But something important for us is to be clear about the priorities of the government. Since the first day, the president was very clear about not letting down the most disadvantaged people in Argentina. We put in place the Human Capital Ministry, where the idea was to collect the different areas that has to do with the human development. But also there was one key decision that has to do with the things that we are speaking here. We still have a health ministry because we understood, and the president, of course, understood that the health issue was very special in Argentina. We needed to do many things to fix a system that was in a very bad shape. Many different sectors are involved in the same tasks, and the current ministry is doing a very good work in terms of reorganizing that. Also in Argentina, the responsibility about health is in the provinces, not in the federal government. The federal government has a role in terms of organizing and trying to level the playing field for the different provinces. They have different income distributions, and so it's a very important role. And since the first day in office, we were focused on doing that and trying to improve the way that the previous government were doing the purchases of vaccines and everything that has to do with health. We've been doing many different things, opening imports for having better prices and have a more competitive supply for the public and the private sector. And that was something very important for us in order to being able to show the people that we were doing a very significant adjustment in terms of the budget, but not hurting the people that were more in need.
Yeah. So, lesson from Argentina for countries around the world is you look to prioritize health investments with these, I think probably even growing fiscal pressures, is not forgetting about the people and not forgetting that when you have these fiscal pressures, that you need to still be delivering on a social context for the people writ large, and this has been part of your focus. Now, part of this is also, when you look at this, is how do you also distinguish efficiency from austerity as well?
Yeah.
Many countries, as we're talking about, are grappling with tightening budgets. There's growing interest in reforms that improve outcomes, but improve outcomes without expanding spending.
Mm-hmm.
And so trying to hit both those. So what are the structural reforms that other countries could potentially follow based on your experience to improve efficiency in spending, but doing so without increasing overall expenditures?
And there were many different measures that were undertaken by the government. First of all, we have to use technology to improve the way that health providers, public providers, make their purchases, how they allocate resources. When we started in office, there were many hospitals that are publicly managed by the federal government. They were purchasing their medicines. They were hiring the services for each one, and was in a decentralized way. We started to centralize that, put a common administration for the whole system of public hospitals, and that was a very big saving in that terms. Also starting to use the records, the electronic records for tracking health, the people's health in different provinces. If they move to another one, their health history is already there, and they can keep with the health assistance that they need. And also starting to, as I said before, starting to open the economy to new suppliers. That's something that is very, very important. Changing some legal issues that were setting some restrictions in the way that the public health system was working in the previous years. And then start to be very careful about which kind of health service is needed in which provinces, starting to reorganize that, to also help the local governments in order to improve the purchases of medicines and things like that. When we started in office, for instance, we found that we have to destroy like millions of vaccines because they were updated. And there were provinces that have a stock of vaccines that they didn't need, and there were other provinces that they were in need of those vaccines and they didn't knew other provinces have that. So we put in place some information technology systems in order to be able to improve that.
So what I'm hearing, Secretary, is when you talk about efficiencies in spending for better health outcomes without increasing expenditures, you're really leaning in on technology, public records, but also not just efficiency in spending, but efficiency in distribution and making sure that was being done across the country.
Yeah, we have some cases, that, for instance, in the news it was known that there was some health issue in one province, and all of the provinces were buying medicine for that, and they were not going to have that issue.
That issue, right?
Because it's something that is for tropical regions, and in the Patagonia, they don't need that, but they were buying that. So starting to improve in that sense is something very important to be more efficient when you have a budget restriction. That's the new thing in Argentina is people getting to know that is something like that it's called a budget restriction. And we are trying to work with that and try to explain that we have to be very careful about the way we expend those limited resources.
Yeah. So we were talking earlier about prioritizing health efficiency, health investments with fiscal pressures, but also there's a growing need to be able to link spending to an economic growth strategy as well. And so governments are increasingly being asked to justify, not just socially, but also in terms of economic returns, the spending. And so how is Argentina, and you started to get this a little bit earlier, but how is Argentina incorporating spending into broader economic growth and productive strategies? How is, and the economic returns that come with that, and how is it thinking about health as part of those broader economic returns?
Okay. Well, since we started in our term, we were putting in place different kind of incentives for investments in different sectors. This week, for instance, we already put in place a new regime for small investments that we think are going to be very, very helpful for developing new ways of investing in the health sector and many other sectors. Also, we've been putting in place some new ways to incentivize the hiring of new people. There is a big issue in Argentina with the informality in the health sector, so this is something important for us to give the chance to be in a formal situation for the different people that works in the health system. We are also seeing some geographic changes in terms of demographics, people moving from the greater Buenos Aires to provinces because the new opportunities are there, like Vaca Muerta, for instance, in Neuquén, or the mining industry in other provinces. And they're starting to see the need for investing in health services. We are working with, for instance, with the World Bank and the Inter-American Development Banks in ways to improve the health services in provinces. We are working in many different ways. As I said, we strongly believe that human capital is key for the future of Argentina, and one of the largest assistance program for kids in Argentina has a component that if you don't present to the authorities that you are giving the vaccines to your kids, you are not taking care of them in the way that should be taking care of their health, you have a reduction in those subsidies. Mm-hmm. So there is a strong incentive there for people to keep updated with the vaccination of the kids. That's something very, very important for us.
Well, going into the provinces, I think when I was there last week with our incredible team, and even before that, even being in New York a month earlier for Argentina Week, and seeing about a dozen governors being up in New York for that, is the tremendous, as you're mentioning, the tremendous interest and the tremendous growth potential in the provinces of Argentina. That's what we message consistently hearing as the future is with provinces. And so, as you're discussing the steps being taken to improve efficiencies and health outcomes, so important that you're looking not just at the federal level, but working across provincial governments and trying to find that alignment, I would assume, in spending as well. Because that spending is coming from the federal government, but it's also coming from provincial governments as well.
Yeah, it's very important for us, the fiscal situation of the provinces. We know we cannot do everything or we are not going to be able to develop as a country if the provinces don't change the way they've been doing things for the last 20, 30, 70 years. We don't have to be clear about a time frame. And we are working with most of the provinces in that regard. We are helping them to see where they have room for more efficiency. As I say, also helping them to improve the quality of the public services that they provide. Health is one of the most important services that the provinces have to provide. And we also go to the provinces, and we see that, for instance, we went to a province a couple of months ago, and they said, we have this machine in a hospital, and we were not able to put it to work. It was a nuclear resonador, I don't know how you say that.
Yeah.
And they have that for 2 years in a box because they couldn't put it in place. They don't have the funds to make it work. They don't have the human resources to make it work. So we are starting to change that, to help them to in putting in place those technologies and being able to use it, because otherwise people have to move from the Patagonia to Buenos Aires to have a better treatment, and they have the machines there and they are not able to use that. Yeah. So that's also a way to improve the efficiency in expenditure.
Yeah, so
we are helping them in
so important for efficiency and for investments in Argentina, the human capital and the focus of health as part of human capital development. I want to make sure we talk about the role of the private sector, long-term sustainability, and also some of these trade-offs under constraint in the time we have left. I will also say the importance of health goes to the fact that our ambassador to Argentina is a medical doctor, even, right? So Ambassador Lamelas, a great representative of the United States in Argentina, managing trade-offs under constraint. So with fiscal tightening becoming the norm globally, what we're seeing is policymakers facing these really difficult trade-offs across sectors and priorities, and I think in particular, Argentina has seen this under President Milei. In this era of global fiscal tightening, how do you protect? And we've talked about some of the steps that have been done to make health investments more efficient. But how do you protect or even expand some of these efficient investments in this era of global fiscal tightening, and in particular the fiscal tightening that you're seeing in Argentina? Yeah.
Well, the good thing in Argentina is that we already done the adjustment, so we are already in a position that we feel comfortable about the level of expenditure. We still have to see the impact of the investments that are already in place in Argentina, and the new that are coming in, and how that is going to impact in terms of growth. And that is going to allow us to have more resources to invest in health or in any other public services that we want to provide. It's not that we are going to do different things than the ones that we are doing right now, because the president was clear from the first days. He says we are going to do the things that the federal government should be doing or should have done for the last 100 years, and federal government were doing many more things that they should be doing. We are concentrating on that, and at the moment that the economy starts to grow faster and stronger than right now, we are going to have more room for doing or improving even more the quality of living of our people. Since we started in office, for instance, one of the first decisions of the president was we have to do this adjustment, but first of all, we have to increase the social assistance to the more vulnerable. We double the level of assistance to that segment of the population, and we still are keeping that in real terms in order for people, the poor people in Argentina, to be able to access basic services. He's very clear about that, and we work very, very strong in that regard. We know that we can make adjustment in many areas, but social services, health services are not the ones that are going to be hurted. Yes, we have to do many efficiencies in that part. We still have a lot of room to improve there, and that's the way that we are doing. And also in terms of the why investing in Argentina in this geopolitical moment is very clear about that. Argentina is a country that has no religious race conflict we don't have any threat with our neighbors. It's a very safe country, and in geopolitical terms, it's a very important ally for the U.S. also. And it's a country of peace, and in a region that is very peaceful in this moment. So that's something that is very important at the moment to decide an investment, and we think that's something that we should be working harder in showing that.
Well, when we were in Argentina last week at our conference, Ambassador Lamas, medical doctor, said the time to invest in Argentina is ahora. Don't wait, because you'll be behind on the train.
Yeah.
Also when I was up in New York last month, I was moderating a panel actually on the health industry in Argentina, and talked a lot about some of the different innovations, and also we talked about the role of the private sector. There's many members of the private sector that are here in the room or watching via ACTV, which goes to my next question, since we haven't spoken yet about the private sector, but the role of the private sector in all this. There's increasing emphasis on mobilizing private capital, of course, to complement public resources. And we're seeing this particularly in constrained fiscal environments. So what is the role that you see for private capital and partnerships, which are so fundamental? We talked about in New York during Argentina Week as well, the role of partnerships in strengthening systems, but also without compromising equity, which is so important.
Yeah, well, it's the president is very clear about that. He says every time that he can that the future of Argentina is only viable if the private sector invests in Argentina. It's not that the public sector is going to save the country. It's the private sector, the one that has to lead the process. We are removing most of the regulations that were trying to close the economy, to avoid foreign investors to invest in Argentina, to use the high level of human resources that we have in the health sector. We are changing many rules in order to be able to, for instance, start to be a hub for trials in Argentina that we didn't have for many years. There was trials during the pandemic, but it's not something that it's common in Argentina. We are working in that regard in order to open the country for that kind of trials, and also being very open to any investment that the private sector wants to do. If they need the support of the government, we are going to be there for that. We are working every day with the private sector. We talk a lot with companies, with associations, and everyone that wants to understand what is going on in Argentina, and trying to push them to invest in Argentina, of course.
Yeah. And I'll say that was also one of the big takeaways that we were down in Argentina with John Jovanovich, the president and chairman of the U.S. Export-Import Bank, and lots of interest in those, and the private sector and those partnerships, and also the role of the U.S. government in helping to accelerate some of those investment opportunities. We're nearing the end of our chat here, but I want to ask you, Secretary, about long-term sustainability as we move forward. We've talked about all the important reforms that have been made. I think many of the lessons that Argentina also has and can share for other countries around the region, and efficiency, and also doing so in constrained fiscal environments, prioritizing social issues, prioritizing health as part of the broader economy. But sustaining reform over time really requires alignment between short-term fiscal priorities and also long-term development goals. So how are the current fiscal priorities being aligned with those long-term strategic goals to ensure the continued productivity and continued productivity growth of a healthy but also an empowered population? How are you looking at this? We've talked a lot about what's been achieved and what you're looking at right now, but how is this being looked at on a longer-term basis?
Since the first date, as I said, we created the Human Capital Ministry. The idea is to improve the quality of health services, education, and we put in place some special programs for the first 1,000 days of a child in order to develop their capacities. It's very important that period of time, and we decided to put a strong effort in that program. Also, in the situation that we started in office with no access to capital markets in any way, we were in need to make the fiscal adjustment in order to show that we were going to do the things in a different way than in previous decades. And that was the first step to start changing the view of Argentina in the international community. Now, when we come, when we come to US or other countries, we see that people understand that we are doing the things in a different way, and they are starting to believe that we are going to be able to sustain these changes in the midterm. And also, the election last year was very, very good in that sense, and we are very, very confident that we are going to be able to sustain this in time.
So, Secretary, we're out of time, but I do want to ask you one last question, something we have not covered as part of this conversation that you want to make sure that our audience in the room and our audience watching on ACTV knows, insofar as how the Argentine government, how you're looking from your perspective as Secretary, how you're looking at prioritizing health and investments, and maybe some of a challenge that you've been able to successfully deal with that might be a lesson for other countries.
It's very important to have to have a clear priorities in which areas you need to invest. As I said, childhood is the most important investment that one can do. That has to do with health and with education. Those are the most important areas that should be invested, and that's the thing that we've been doing. We decided to cut expenditures in everywhere, not there, and that's the way to have a better human capital for the future.
What an excellent way to end this conversation. Thank you so much, Secretary Guberman, for coming here today.
Thanks.
We're going to now transition to a panel that will be moderated by my colleague, Senior Fellow here, Enrique Millan. So thank you. Thanks again so much.
Okay, thank you, Jason, for that incredible conversation with Secretary Guberman from Argentina. Now we will continue our programming today with this panel. It's an expert panel to do a deep dive into cross-sector collaboration and the implementation of smart health financing. I'm joined here today by Santiago Cornejo. Santiago is the Executive Manager of Revolving Funds at the Pan American Health Organization. Also joined by our colleague and dear friend Yanet Giha, Director of FIFARMA, and by Dr. Michele Gragnolati, Practice Manager for Health, Nutrition and Population for Latin America and the Caribbean at the World Bank. As Jason was mentioning, this ongoing work with FIFARMA, it is a partnership that is here to last. And part of our best interest is to publish a policy document at the end of this year that will try to collect the most relevant information about the importance of investment in health in Latin America. So as a scene setter, I'm going to very briefly share with you 3 slides that explain a little bit of our work, and this could be very useful for the purposes of our discussion. So the first graph shows how Latin America and the Caribbean has been spending in terms of fiscal spending in health. As you can see, the region has an average of around a little bit more than 6%, and the red line shows the average of the countries around the years. You can see that some countries are investing over that average. Some of them are as high as 10%, but are others very below that average. And you know, PAHO recommended the importance of investing at least 6% of the GDP on health spending. Now, if you try to compare health spending and productivity, so the linear relationship shows that evidently there is a direct relation between health spending and productivity. And the countries that are located in the upper part of the chart are the countries that are expending the more per capita on health, but also are receiving the dividends of productivity. And finally, we try to do a relation between what is the raw data showing right now and what is the perception of the general public in Latin America. So thanks to a partnership that we have with Gallup, we have the availability to explore what is the satisfaction of the population about the quality of healthcare. And you see that roughly 50% of the people in Latin America and the Caribbean are satisfied with the type of healthcare system that they're receiving, but there are some cases that worries the most. So you can see countries like Chile and Brazil that are increasing their satisfaction on over 50%, and countries like Venezuela that at the early 2000s had an average of over 45% and right now is very below 6%. So jumping up into our conversation, I would like to start with a general question for our three panelists, and I will start with Dr. Gragnolati from the World Bank, and then Santiago, and then Yanet. Michele, what does smart financing in health mean in practice, and what is one concrete example that you can think it will be useful for Latin American Caribbean governments?
Thank you very much, first of all, for organizing this event and for inviting the World Bank. The Atlantic Council and FIFARMA and the other sponsors have been great, starting with the pandemic, but beyond, to keep the focus and help create momentum on health. For us now at the bank, health has been selected as one of the 5 priority sectors, not just to help deliver 1.5 billion services to 1.5 billion beneficiaries, but also as a potential high job creator. Smart financing. Smart financing is not about spending more. It's about spending in a way that changes the way systems perform. And it's a completely different shift in thinking. And there are many things you can say, but you can start with thinking of 3 key elements. First, you need to align financing with results, moving away from historical input-based budgets to paying for coverage, quality, and efficiency. The second, and this is absolutely critical in Latin America, where fragmentation is at the basis of all health systems that were created more than 100 years ago, and most of them have not changed their regulatory institutional framework. The second is about reducing fragmentation. We need to integrate financing and delivery so that the system works at one. And the third, and it's been discussed and it's becoming more and more clear, that we need to leverage the private sector deliberately. And so that private provision expands access and improves performance. In terms of countries that have had policy, there is so much that is going on in Latin America. Undersecretary Guberman already mentioned some very good policies that the government and the Ministry of Health of Argentina are putting in place in managing the pool of national hospitals together, in creating efficiency through technology and economies of scale, of procurement of equipment and drugs, for instance. In my opinion, Brazil is a very good example. Brazil has a universal public health system, but more and more there is a shift towards including the private sector. Private sector in Brazil delivers more than 40% of health care, and of course, higher proportion in specialized care. So the challenge is not the presence, it's the integration. And more you see shift towards strategic purchasing and stronger regulation. So that public financing can buy services more efficiently from the private sector while aligning them with public goals as well. And the result is a movement towards a more coherent system. And this is a little bit the framework that we have more intentionally, explicitly adopted recently at the World Bank, so that we try to link financing not only to health outcomes, which of course remains central, but also to system performance, to smart private investment, and to job creation.
Thank you, Michele. Janet, now let's turn to the private sector view about this smart finance in health.
Thanks, Enrique, and thanks to Atlantic Council for organizing this conversation that we're having here today. And I do think opening this conversation to others different than health is a key aspect of what we're trying to do today. So first, let me say a few things about FIFARMA. We are the Latin American Federation of the Pharmaceutical Industry, and we bring together companies. We have some of those companies here today with us, but also associations, and we're all around the region. We are in countries like Mexico, we work in countries like Brazil, and basically all Central America. I mean, we are all around the region. And we work with many organizations with the firm conviction that we will be able to have better health and better development and welfare for our people, for our patients. I think that is something that we have in our DNA, like many other organizations that are out there. And we think that we need to work with many of those to really move this agenda forward. We have many challenges in the region, many challenges, but a lot of opportunities as well. And definitely there's one big opportunity, and it's turning to see health as the most important investment, because it makes people healthier, but also it can really detonate a lot of our potential. And I think that is like the main task of many of us here. It's like, how can we really go out and bring this message in a good way so that we include many in the conversation? I liked that we had previously the Secretary of Treasury talking about health. I mean, those are the type of things we need to do. We need many to talk about this topic as if they were working on the health sector. That we don't see that a lot today, but that's our dream in many respects. So having said that, let's go to the question of smart health financing. And for me and for us in FIFARMA, how we see it is putting our resources where we can have the best return in health, because we cannot forget that any investment in health is for health, but also for welfare, development, and economy. It's like, really being able to tackle examples or to tackle projects that can really get into that. The region, as I said, has a big challenge in this respect. Any figure, any report that you go out there and see shows it. Pajo has been saying it. The figures that Enrique showed is public and private expenditure, but Pajo has said public expenditure should be 6% of the GDP, and very few countries are there in the region. So we have a big gap. When we go to OECD, we have a big gap with OECD countries, and every report shows it. We did last year a study with Duke University showing that we need to spend more, because that is important to mention. We need to spend more and better, both. It's not one or the other, it's both. And I think that's another comment that we have to make here. So there's like a big line of work that we need to do, and we need to do it, all of us together. An example, a very specific example, the PAHO program around hearts I think it's a very good example when we're talking about smart health investing, because it's basically going into a situation that we all have globally. It's cardiovascular disease. It's understanding that we have a big issue in Latin America with that respect. It's going into the primary care centers. I have the figures here. I think it's more than 7,000. You were going to say the same one? Yeah. So you can complement, and it's providing treatment for almost 6 million people, 5.7 million people. And I think, why do we think those are the type of models that work? Because at the end, what this is doing, it's investing early to really get returns later. And that's one point that I have to also mention before I give the word to Santiago. It's when we think about smart investing, we have to think long term, because many times something that costs you a lot at the beginning has incredible returns at the end. And we are not used in Latin America to thinking long term. So that's like another aspect that we have to do. So that would be my answer to the question, Enrique. And I'm sorry, Santiago, that I took the example of heart from you.
Thank you, Janet. And I completely agree with you. Well, the graphs show us that precisely those countries that have been investing in the long term in health, they can see the returns in productivity in the long term. So, Santiago, now let's move to you. And what is the point of view of PAHO about this?
No, first, thank you very much for the opportunity to present in this panel. And for us, of course, as the Pan American Health Organization, it's critical that we increase investments in health. And I think it's great to have not only this panel, but to have an undersecretary of Treasury speaking so eloquently about the need and why a country is investing in health. It's a great sign. The difficulty of coming third is already, Michele talked about the importance to expenditure. It's not about spending more, it's about spending smart in the result. Great example of heart. So let me go back a little bit to that 6.6% of GDP that you started, Enrique, because the great news is, yes, we're seeing public spending increasing, and particularly public spending is increasing in social health insurance, so as we see, which is a smarter way to invest and to reduce risk. Now, still what we are missing is that this is not enough. Why? Because as Janet was mentioning, not of that 6.6%, everything is public spending. In fact, we have still in our region, 32% of the spending is out of pocket. And why that is a problem? Because we know that impacts even more the poor. Prior to the pandemic, 10 years before the pandemic, if we look at the period 10 years before the pandemic, we saw an increment of 15% in the population that was pushed under the poverty line because of out-of-pocket spending in health. Now, where is that out-of-pocket coming? One of the big drivers is medicines. We see that out of pocket, 40% is to purchase medicines and pharmaceuticals, which is not a surprise given that 1/3 is about the total spending is in pharmaceuticals. And the public spending is only spending 20%. So here I think we have a challenge, and it's something that we need to work on, particularly when we look at the epidemiological transition of our region, non-communicable diseases by 2030 being over 80% of the cause of death. We know we have great technologies that need and can help us to prevent, and the pipeline is incredible, but we need to work on how do we make that investment smarter. And we believe that one way to make it smarter is one of the examples that is the regional revolving funds, which is a unique mechanism that only our region have of pooling procurement in order to have more sustainable access, more sustainable for pharmaceutical companies, but more sustainable for countries too. So now we believe that that's a way that we can help to bring smarter spending and help us to achieve some of those goals that we want. And I will be very happy to explain a little bit more about the revolving funds and why is the smart way to invest.
Thank you, Santiago. It's important to notice that this is the second time in a row that the Adrian Arce Latin America Center introduced to the regular programming of the IMF World Bank Week the theme about the importance of investment in health. During the fall meetings, we did a private roundtable also with PAHO and FIFARMA about the importance of this, and we took some examples around the region. Now, today, we decided to do a public event trying to spread the word about the importance of this reasoning around Latin America and the Caribbean. Let's move to individual questions. I would like to start with Santiago and continuing with you. PAHO has consistently recommended that countries allocate at least 6% of their GDP to health. But what specific actions has PAHO undertaken to encourage countries to adopt this target that goes beyond efficiencies in spending and, more important, to view health as a strategic investment rather than a cost?
No, thank you very much. And definitely, through our technical cooperation, we have been supporting our member states in guiding, providing evidence, analytics in order to help create those initiatives that will make smarter investments. And that's why I wanted to come to the issue of the revolving funds, which is a unique mechanism that our region have. Other regions are now trying to incorporate or to develop their own regional pool procurement. Ours were established more than 40 years ago. So we have the experience. We procure for the 33 countries and 9 territories in our region. So that gives us an economic of scale, over $1 billion of procurement. And through that economy of scale, what we have been able to achieve is more sustainable pricing, sustainable for everyone. And why we would do the volume. Second is we ensure quality. And then we simplify processes and predictability, which we know is critical, the predictability. And more important, since we are focusing on that public spending, as I was mentioning before, we bring transparency to the system. Now, we have been transforming the revolving funds, and one of the key priorities that we are now focusing on is how do we incentivize regional manufacturing? A lesson from the COVID pandemic, we need more regional manufacturing. And I want to come to this example because before the COVID-19 pandemic, only the revolving funds were only procuring 1.5% of the total volume from the region, despite having a very advanced pharmaceutical industry. Now, since in the last 2 years, what we have been working is about a little bit what Jason was talking about, partnerships. We have created partnerships between multinationals and local partners, local pharmaceuticals, to accelerate that technology transfer. And now we can say that we have agreements that can supply over 25% of our volume from these regional manufacturers. Now, these investments not is only making the products more sustainable, it's not only helping to accelerate access, but more important, it's a clear example of how health can be an investment. Why? These examples are in Argentina. These 2 examples that we have that will help us to 25% will accelerate exports by $250 million per year. These are multi-annual agreements, so over $1 billion in exports. Is bringing investments to develop the pharmaceutical sector in Argentina. It's creating jobs, and it's helping all the other industries, from paper, the boxes, printing, logistics, that need to be generated in order. So clear health being an engine, not just of human capital, but of the economy of the country. So this is where one of the areas, and now one of the areas that we want to work together with all the actors in the private sector, is about how do we help to bring more accessible medicines, particularly what is called the high-price, high-cost medicines, and how we can work in these areas. And here we're even working with the Inter-American Development Bank in setting up an innovative financing mechanisms, the one that were set up originally for low-income settings. But given the challenges that we just mentioned, we also are adapting them to the context of Latin America to be able to incentivize and to bring more access to these treatments that will be very critical when we look at how non-communicable diseases, the impact of non-communicable diseases in our region.
Thank you, Santiago. We are running almost out of time, but let me finish with two questions, one for Michele and one for Yanet. Michele, in most countries in Latin America, health systems are mixed. Actually, Secretary Guberman, during our previous meeting to this event, told us about the case of Argentina, where the private and the public system coexist, and there's also like a hybrid system. And what policies can help increase efficiency for optimal access to quality health services given these circumstances?
No, thank you. I touched already upon this. Indeed, Latin America is the region where health systems are mixed with a big important role for both the public and private sector. And healthcare, for economists, is a very interesting market because it's not the typical commercial market. It's characterized by many market failures and externalities from asymmetry of information, or missing markets, equity risks. It is also what we economists call like a merit good. So it's a good that societies in different degrees believe it should be accessible independent of the ability to pay. So clearly there is a need for a public sector. At the same time, there is a huge value that the private sector provides in terms of efficiency, innovation, and so on. What can we do? What policies? Quickly. First, again, strategic purchasing. It's no more about buying the same services, but buying services based on the results, quality, outcomes, cost effectiveness, and including contracting both public and private providers under similar rules. The second is about having strong regulation and governance, so that in big systems, efficiency depends on how markets are structured. We talk about market shaping. That's a big, important policy for the public sector. It means about setting clear standards, reliable payments, as well quality, pricing, accountability, and ensuring that indeed, at least for certain services, private provision, certain services that are financed with public money, private provisions aligns with the public health objectives. And the third, it's the integration through data, technology, and care pathways so that patients can move seamlessly across providers. Many other things to say, but for sake of time, I'm stopping here.
Absolutely. Thank you, Michele. Yanet, I have reserved the last question for you, so this is a big opportunity to send a message to all our viewers around the region that are watching this event via ACTV. How can innovation in healthcare contribute to improving productivity, reducing long-term costs, and generating economic value for countries?
Thanks, Enrique. And I think that if we go to basically the impact that innovation can have, we could mention at least three ways in which this can happen. The first one, the most important, reducing the burden of disease. I mean, it's thinking about the person and the disease and basically the effect that can have in the health of any given person or patient. I mean, we can all be patients. So second, it avoids, and I mentioned it in the previous question, it avoids future costs. I mean, it's really, understanding that if we invest in a good way and in the right way in innovation, it can really have a lot of other impact thinking about the future and thinking about long term. And finally, something that has been said a lot here, we spoke a lot here about efficiency, and here we can really also tackle and impact the system efficiency. I mean, if we understand that innovation with early diagnosis, I mean, with many other elements come together, they can really also have a good impact and a great impact in terms of the system efficiency of our health systems in the region. Now, I want to send a few words regarding how the region is in this topic. One of the things that we've done in FIFARMA in the recent past is creating a lot of evidence. We understand that bringing evidence to the conversations make the whole difference. I mean, it's really bringing data. We partner with very, very relevant stakeholders around the world, sometimes universities, sometimes think tanks, organizations that can really help us have good reports reports that really show what we're having in the region and what can we do to really change the situation in the region. And I want to bring very quickly two of them, of those reports. First, the FIFARMA weight indicator. It's indicator, Michele, maybe because you're not part of, directly part of the health systems. I mean, it's important for you, for the World Bank to know that we have this report showing how long does it take for innovation to get to the countries in the region. This is also being done in Europe, but we are doing this in Latin America. And what we see is that it takes for a patient in the region around 5.5 years to get an innovative medicine. So if the US and Europe has it, it takes 5 years for us to get it, or more than 5 years, and it depends on the country. So, and we do this report every single year. We're launching the 5th version this year, and we have basically most of the therapeutical areas. And so that calls our attention on one important aspect that we need to change. And that report are in our webpage, and we have it as one important piece of evidence. The other piece of evidence, I think Connie at the beginning mentioned it, it's the socioeconomic burden of disease for the region. We did this study a couple of years ago with WBweek Institute, and doesn't matter the figure, if it's, sometimes they say big, whatever. I think the important thing is understanding that there's a big burden of disease in terms of the GDP. And what it's showing is that we are not tackling disease in a good way, in the right way. And that's why we're having issues with productivity, and issues with economic return at the end. This report is also available for everyone. And here it brings me to my comment. We're back in time, but basically it's in the region we need to work all of the organizations together to really reduce the times that it takes for innovation to reach. And I think a lot of us need to do effort. All of us, we need to sit down and understand why is that happening. Many, many different reasons. Every country is very different there. But we need to sit together and see what we do. Second, we have the responsibility to bring out strategies to reduce the burden of disease. One of those strategies is innovation, but that's not the only one. One of those definitely is the first thing that I said is innovation, but that's not the only one. And third, and I said it in the previous question, we need to include in these conversations others different than health. I mean, that is one message that I bring all the time. How can we speak their language? I think that's important. We need to understand the language that they understand, so we really can bring them to the conversation and can really change the situation that I just mentioned, because we're really missing here opportunities. We're really not even being able to attract investments in health because we don't have the right ecosystem. So there's a big thing that we need to do, but we need to do it together.
Thank you, Yanet. I completely agree with you. And this is a common effort of all of us to improve the view of the general population and Latin American governments about the importance of investing in health as a priority for the economic development of our region. I would like to end this event thanking our dear panelists, thanking our audience, and a special thanks to FIFARMA, Roche, Johnson & Johnson, and Bristol Myers Squibb for making this happen. Thank you, everyone, and have a nice day.
To run, I know.